Hi, I'm Dr. Christina Hibbert. Let's talk about how hormones affect women's mental health. See, there are many things that we women were never taught, that we should have been taught, that may help us better understand our emotions and why we might feel different certain times of the month or certain times of our lives. Number one, hormones are directly linked to the chemicals of the brain called neurotransmitters that help us feel normal and healthy and well. So for instance, if serotonin levels are low, we know that that means that you might experience some kind of feelings of depression. So it makes sense then if our hormones directly impact the change in neurotransmitters, and if our hormones shift and the neurotransmitters shift, we might experience some things like depression or anxiety or other kinds of mood symptoms during those sensitive times of life. Number two, research has shown that it's really not the levels of hormones in our body that matter as much as how sensitive we are to those shifts in hormones. So even if you get your hormones tested, sometimes it can be difficult to know if you are one of those women that are going to have a harder time because it's more about how sensitive you are to the shifts in the hormones than the levels themselves. That means number three, some women are much more sensitive to those shifts than others. You probably know it if you are, but if you don't, we'll talk in a minute about what you can do about it. But there are some certain times of life where we're just more vulnerable, and if you know that you're sensitive to those shifts, you're going to probably be more at risk for mood symptoms during those times, such as starting your first period, having PMS throughout your life, or PMDD, premenstrual dysphoric disorder, also pregnancy and postpartum, which are very sensitive times, and perimenopause, that time right before we cease menstruation, is a very sensitive time too. So if you know that you're sensitive to hormones, you're going to be more vulnerable to mood symptoms during those times. Now, what can we do about it? Number one, if you are feeling like you might be sensitive or you're not sure, a few things you can look for. How do you do on hormonally based oral contraceptives? If you've ever experienced those or had mood symptoms when taking those kinds of contraceptives, then you're probably at risk. Also, if you've had symptoms like postpartum depression or other issues in pregnancy and postpartum, that might mean you're really sensitive to those shifts in hormones too. Another thing you can do, number two, is to plot your symptoms on a graph or a chart over a couple of months. Do it for at least 2 months to make sure that you get an accurate count. But look at your symptoms once you do it. Write out each day what you're feeling and the symptoms that you have. If your symptoms bulk up around the premenstrual week, meaning about 2 to 3 to 7 days before you start your period, that last week of the month, then you probably, or if they bulk up around ovulation, which would be day 14. So if you see that pattern around day 14 and then right at the end of the month, then you're probably experiencing some kind of hormonally based symptoms. If not, you may be experiencing something like a mood disorder like depression, anxiety, or something else. So number three, the important thing is to talk to your medical or mental health provider about these things. Make sure they are trained and understand this link between hormones and the brain and women's emotions so that they can help you discover tools and coping skills to better navigate those times of your life, especially to help you get a plan in place so that you can feel better during those times. This is Dr. Christina Hibbert, and for more on this topic, visit me at my website at www.drchristinahibbert.com.